This program is brought to you by Genetics Pharmaceuticals, a leading neuropsychiatry company with a mission to improve quality of life for those suffering neurological and psychiatric disorders.
Bismillahirrahmanirrahim. Assalamu alaikum to Pakistan. I'm Akhter, your host. Today is 26 March. This day is also celebrated as Epilepsy Day or Purple Day. Genetics Pharmaceutical Company, in collaboration with FM 100, has arranged various informative programs today, in which we are going to invite various renowned neurologists from all over the Pakistan who are going to share us their experience and tell us something about epilepsy. In our studio today we have got Dr. Akhter with us. Dr. Akhter is consultant psychiatrist and working in Karachi Psychiatric Hospital. Doctor, very warm welcome to show.
You're most welcome.
So, Doctor, we start our question. Okay?
Sure.
Doctor, by the way, what is epilepsy?
Mr. Naveed, thank you very much for inviting me for today's program about epilepsy. How we can define epilepsy? Epilepsy is the tendency for recurrent seizure. What is seizure? A seizure or a fit that occurred in epilepsy. It is because of abrupt excessive electrical discharge in the brain, and because of that electrical discharge, the clinical symptoms of epilepsy occurs. So actually, our brain, there's an electrical circuit. For a lay person, I can say that it's been going on all the time, and because of that electrical activity, our brain works. But if there's an excessive and abrupt electrical discharge that occurred in any part of the brain, then the clinical signs and symptoms epilepsy has occurred. In the same way, heart has an electrical discharge, and we can see that in the investigation of ECG. In the same way, the electrical discharge of the brain can be seen in the EEG, the electroencephalographic investigation.
Doctor, if there is excessive electric discharge, as you've just mentioned about it, so what are the symptoms of this excessive electric discharge?
The sign and symptoms of epilepsy, because epilepsy have different types, and every type of epilepsy has its peculiar type of sign and symptoms. One type of epilepsy that's very common, it's called the generalized tonic-clonic seizures or tonic-clonic epilepsy, and in which the patient has a sudden epileptic convulsions that comprises of tonic and clonic phases of his body. There's a jerking movement of the body, and then the patient lost the consciousness. There's a frothing from his mouth. He may bite his tongue, and there may be incontinence of urine or feces that can happen. Patient may be unarousable and sleepy and disoriented after that tonic-clonic fit. Even when the patient wakes up after the fit, he's been disoriented and confused for some time and does not remember what really happened to him. In one other type of epilepsy that's called a complex partial seizure, and also named temporal lobe epilepsy. In this, the patient does not lose the consciousness, but he has altered state of awareness of himself and about his environment. He also experiences an aura before this seizure happened, and which comprises of olfactory, auditory, visual, or somatic hallucination. On what hallucination is? Hallucination is a sensory perception without a sensory stimuli. For example, if there's no sound, and a person started hearing a sound, or there's no smell and a person starting smelling some good or bad smell. So that could happen in temporal lobe epilepsy. And there's also a disturbance of thoughts and emotions in temporal lobe epilepsy. During that fit, patient have some automatic behaviors that what he cannot remember, that he's been walking or he's making any gestures or any hand movements, and so after the episode he doesn't remember about any of this, what had happened during that fit.
Doctor, you have very nicely explained the symptoms of epilepsy. So, by the way, what is the causes of this?
When we see the causes of epilepsy, we have to consider the age of onset. It is very important. That gives you a clue for the cause of epilepsy. In newborn babies, birth injuries or congenital brain malformations, that can cause epilepsy. In some small children, high-grade fever can cause epileptic fits. In adults, cerebrovascular accidents, that's we call stroke, that can damage the brain, or brain tumors, or head injury that could cause epilepsy.
Okay, Doctor, you have mentioned about the age factor in causes. Doctor, how it is diagnosed then?
Yes, this is very important, how a person can diagnose epilepsy. Epilepsy is essentially a clinical diagnosis that depends upon the detailed account of epileptic attack given by the witness as well as by the patient. This is very important. The history given by the witness who has actually witnessed the patient going through that epileptic episode, and also what patient was experiencing at that time when the doctor asked. So complete history from the patient and from the witness, that is very important. Then the physical examination and some special investigations are directed to establish the cause or etiology or diagnosis of epilepsy. As I mentioned earlier, EEG, that is the electroencephalography, can confirm but cannot exclude the diagnosis of epilepsy. And that in EEG there's abrupt epileptic discharge during the epileptic episode, and that we can diagnose epilepsy by EEG. Neuroimaging, that's the CT scan of the brain or MRI of the brain is also recommended when a patient has epilepsy to find out any brain pathology or brain abnormality or brain injury or brain tumor.
Doctor, being psychiatrist, you have got ample experience in psychiatry. Doctor, what are the psychiatric aspects in epilepsy?
This is a very important question because I'm a psychiatrist. Depression is particularly very common in people who has epilepsy. Suicide is also 4 times, and deliberate self-harm is 6 times more frequent among people with epilepsy than among the people in general population. So in my practice, there are people who comes to me and have epilepsy, but they also have a vast number of patients have depressive symptoms, and they came with the history of deliberate self-harm, So we treat epilepsy as well as depression in those type of patients.
So once a patient is diagnosed epilepsy, what are the treatment options available?
Epilepsy is treated by various anti-epileptic medications. Initially, the medications are started with a lower dose, and the doses are gradually increased. Some medications have certain blood levels in which they works more effectively. So blood levels of those medications are also being checked to see whether that is under therapeutic level or is more than what is needed for that patient. Some patients requires more than one anti-epileptic medications for the effective control of the seizure, but sometimes the patient cannot be controlled by only one anti-epileptic medication. Epileptic fit can also be precipitated by sleep deprivation and by certain medication that can decrease the seizure threshold. So this is one thing is very important, for patients who have epilepsy. They should have enough amount of sleep, ample amount of sleep, because less sleep can stimulate their brain, and stimulation of brain is one of the causes, of patient going to epileptic fit. And the other thing is that as I mentioned, there are certain medication that can decrease the seizure threshold. If epileptic patient are taking those type of medication, even on anti-epileptic medication, that can precipitate epileptic fit.
Dr. Akhter, our listener must have been benefited out of your informative discussion and questions. Doctor, thank you very much for spending your valuable time with us. Thank you very much.
You're most welcome, Naveed Saab, and this is my pleasure, that you invited me here for the Epileptic Day.
Okay, thank you very much.
Most welcome.
This program was brought to you by Genetics Pharmaceuticals, a leading neuropsychiatry company with a mission to improve quality of life for those suffering neurological and psychiatric disorders.